Yes. Inability to cope with the perceived distress. The real addiction starts when person stops trying to cope with the distress by means of conventional methods, which in his/her past experience consecutively failed. Then the person experiences ever-deepening depressive anxious emotions, and to fend them off decides to use chemical substances or overdo a behavior that directly counteracts the negative emotions on the neuronal level. Normally you'd use your coping mechanisms to mitigate the distress, this is your defense mechanism. An addict, when confronted with the force of negative emotions, doesn't defend himself but applies the force that is opposite. A rewarded brain can not be depressed. That's what I always say. Other than that, all addictive substances also have a common source when it comes to genetics as well. They all increase the expression of increment Phos-B in nucleus accumbens in the brain. This is thought to be the primary genetical mechanism in developing addiction in terms of the reinforcement of stimulus, increasing chances for action happening again in future. The direct reasons when it comes to people engaging in addictive behaviors are varied. Some do it for fun, to cope, because of peers, because of beliefs, because they want to try, or simply for pleasure. However, it doesn't contradict my point. Because if somebody uses drugs purely for fun, then we cannot talk about a real addiction in such case, because this requires a deep psychological root, and use for pleasure is simply an abuse and that's all. It can result in physical dependence to a chemical but not addiction. So, my answer is yes, except that I do not believe that all addictions have the same root cause. I know it for sure. Addiction is a complex neuropsychiatric disorder, cause is multifactorial, a combination of genetic, biological and environmental, behavioral, social, cultural factors are contributing in development and progression of the disease. It's not as simple as we think. All mental illnesses can be categorized under environmental behavioral risk factor for addiction. However, addiction is a primary disease, it's not a symptom of any other condition. Just treating trauma, anxiety, depression or bipolar disorder won't resolve addiction. Neurobiology, symptoms and treatment of mental illnesses and addiction are different. We need to treat both psychiatric illness and addiction at the same time. Research showed that treating psychiatric illnesses may or may not change the course and prognosis of addiction, but left untreated addiction will get worse. That's why we use the term co-occurring disorders. And treat both for best possible outcome. Some average data below. -80% of the antisocial PD patients got SUD, substance use disorders. -60% of the bipolar patients also suffer from SUD. -50% of ADD, ADHD patients got SUD. About a third of PTSD patients got addiction. -20% to 25% of patients with anxiety disorders and depression got some form of SUD. -25% of the schizophrenics are alcoholics, not to mention nicotine addiction. Hash will reach 90% compared to 20% of the general population. We often forget medical issues. People who are suffering from chronic medical issues are more prone to have SUD.